Hello, Facebook friends. It's Carly, your online doctor, with today's Live in 5. Today is Monday, February 3rd at 5:22 p.m. I apologize for the next, besides today, but the next 6 weeks, I have a conference call that's supposed to run from 4 to 5 p.m. and as you can see, it runs over. So I'm going to put a poll. Hello, Emily and Slobodanka. I'm going to put a poll up and you guys let me know if you want me to just be late on the Mondays or skip the Mondays for the next 6 weeks. Nothing I can do. I can't hop off the call. I have to stay there. So that's why I'm late. All right. So we started talking last week about the winter blues, okay? Our moods are not the only thing affected by the winter. Some people with respiratory conditions such as asthma find their symptoms actually get worse when it's cold outside. When you have asthma, your airways swell up and become inflamed in response to certain triggers. The swelling occurs throughout the airway. So if you can think about it as like a tube like this, it swells all around, making it the passageway smaller. Okay, so it makes everything narrower, which makes it more difficult to pass air through those smaller tubes, giving people the feeling of shortness of breath or difficulty breathing. If you've ever had difficulty breathing, it is very uncomfortable, it is very anxiety producing, and it's definitely not pleasant. So we don't want this. We want people who have asthma to feel better. So winter actually can be difficult for asthmatics because the air is dry, right? When you breathe in dry air, you cause the natural fluid lining the airways to evaporate faster than it can be replaced. These dry airways become irritated and swollen. Like I said, cold air also causes histamine release, which you also release during an allergic reaction. Most of us are familiar with that, and results in bronchoconstriction, making breathing more difficult. Hello, Denise. Cold weather also drives you indoors because it's cold outside. And inside you have dust, mold, pet dander, and all other things in higher quantities, and all of which are asthma triggers as well and can make breathing more difficult for asthmatics. So winter in general, in the cold, up north, is a much more difficult experience for asthmatics. So what can you do if you are asthmatic to avoid attacks when it's cold? Number one, when the temperature dips very low, especially into the low teens, I'm talking Fahrenheit or lower, yes, you have to stay indoors. If you have to go outdoors, cover your nose and your mouth with a scarf to warm the air before you breathe it in. Okay, so by actually covering that, you allow that moisture that you exhale to kind of come back in and warm and moisten the air before you breathe it back in. Hello, Teresa. Number two, drink extra fluids, okay, because that keeps the mucus and fluids in the lungs thinner, okay, and easier for your body to move around rather than allowing them to get very viscous, very thick, and that makes it even more difficult for people with asthma to breathe. Hi, Cecilia. Number three, avoid people that you know are sick. Well, that's a general rule regardless if you're asthmatic or not. Wash your hands or even wear a mask if you have to be around people that are sick, okay? Asthmatics and anybody with any type of respiratory chronic condition really needs to watch their exposure to people because it's just a setup for getting yourself sick and then worsening your baseline medical condition. Number four, vacuum and dust your home often. Okay, that's going to help remove the indoor allergens. You want to make sure that your vacuum has a nice HEPA filter and things like that so you're not just kicking the dust up into the air. And number five, wash your sheets and blankets often. Wash them every week at least in hot water to get rid of dust mites. They do have special pads that you can put underneath your sheets, which help prevent them from sticking around. But they're pretty tenacious little critters, so you really have to make sure that you do this very hot water to clean off your sheets and get those dust mites gone. Now, some natural remedies to consider for people who have asthma. Number one, ginger. It helps to reduce inflammation. Figs promote respiratory health by actually helping to drain the phlegm, that thick mucus. Garlic helps to clear chest congestion. Caffeine is a bronchodilator, so a nice hot cup of tea is going to help also with that humidity and the moisture. Eucalyptus essential oil in general is a natural decongestant. You can use it topically or aromatically. Honey also helps to clear phlegm. Local honey is really good because if you get raw local honey is going to be, they're going to be using pollinating, if you will, local plants, so that if you are allergic to something, you're going to be able to fight it better because it's a local pollinated flower or tree or whatever else. Hope you understand what I mean by that. Onions decrease inflammation in the lungs. Lemons or lemon essential oil are antioxidant and anti-inflammatory. And peppermint essential oil is also a decongestant. So again, any respiratory conditions in the winter need to really, really need to watch certain things, watch the humidity in the air, watch your level of hydration, and consider a lot of those natural treatments. I'm not saying that you shouldn't be on a prescription medication. That's not my place to judge. If you are on one and have any desire to get off of one, you need to substitute it with something natural because you're going to need that ability to bronchodilate some way. Okay, so again, discuss it with your physician. And do your best to stay healthy this winter because it's cold out there in some places, okay? And it gets really dry. So on that note, I hope you guys are having an awesome Monday, and I'll see you again tomorrow for another Live in 5.